Black History Month is a time to honor the strength and legacy of the Black community, and that includes focusing on health. Heart disease and stroke disproportionately impact Black men, with hypertension playing a major role. So this morning, we're joined by Dr. Lonnie Sullivan with Cone Health to explain what can be done about this and how to lower your risk. So good morning, and thanks so much for joining us.
Yeah, thank you so much for having me. This is a true honor to be here.
And it's such an important topic that we should be talking about year round. But I want to ask you, why are Black men at a higher risk for hypertension and stroke compared to other groups?
Yeah, so when we look at the data, we know that Black men have the highest risk of stroke, as well as the disproportionate burden of high blood pressure. A lot of that has to do with access. You know, there's a disproportionate burden of poor access amongst African American men in terms of being able to access health care. And then lack of awareness. You know, if you don't know that you have high blood pressure, then you don't know that you're at risk. And, you know, I like to call it the silent killer. You know, you don't know you have it until it's too late oftentimes. So it's a combination of lack of symptoms plus lack of access and awareness.
So the silent killer, hypertension, what makes it so dangerous and what does it actually do to the body?
That's a great question. So hypertension truly affects almost every organ in your body. So it can affect the brain, leading to stroke. It can cause heart failure by putting pressure on the heart, cause heart attack. It can affect your kidneys, leading to renal failure, amongst a host of other things. And so there's really no organ that's not impacted by high blood pressure.
I want to talk about preventative care. You know, we have uncles, fathers, loved ones, and there's this notion that men, especially Black men, don't get their routine checkups. How critical is that preventative care?
Oh, it is essential. So, you know, I'm 33. I go to a primary care physician. There's nothing more valuable than your health. If you can catch high blood pressure or signs of atherosclerotic cardiovascular disease early, then you can prevent yourself from having those bad outcomes. So getting a checkup, looking at your numbers, single most important thing you can do for your health.
What are some lifestyle changes that folks can start today?
Yeah. So if you're going to have the greatest impact in reducing your blood pressure, diet, exercise are two of the greatest things that you can do. So weight loss has the biggest impact on overall blood pressure reduction. And then salt intake, reducing it to less than 1,500 milligrams a day, has a dramatic impact too on your blood pressure. So healthy lifestyle, diet, exercise, and then I always like to say don't pick up any new bad habits, tobacco use, recreational drugs. You want to avoid those things as well.
This is excellent. So before we wrap up, what is one thing you want every Black man that might be watching this morning to know about protecting their health?
Yeah, you know, it is one of the most important things you can do, because within the Black community in particular, our Black men are of such value and they are staples within our community. And if you're not healthy or not around to be able to support your family and your community, or be an example for other Black men that are, you know, growing up, then it hurts all of us. And so there's no shame, there's no fear in getting, you know, your annual checkup. It's the smart thing to do, it's the wise thing to do. And it's something I recommend for all people, but especially us as Black men, given our risk.
All right. Well, thank you so much, Dr. Sullivan, for joining us this morning to talk about such an important topic. We'll have all these details up on our website.